The student or coworker has fallen down the stairs and is laying at the bottom of the staircase, bleeding from the head. What equipment do we have to take care of it? All right, that's going to be what we're going to try to use for this short training. I want to show you, help you gain knowledge on what we have in our new med bag, as well as who can use what and where it's located. So, four main topics I want to kind of cover with y'all today are where the med bag is at, who can use the med bag, what equipment we have, and then some specific operation of what's in the bag itself. So, has everybody seen where the med bag's at? No? Okay. Right at the receptionist desk, where the AED used to be on that back wall, the AED has been moved around to the front wall now, and it's in a case. If you open the case, it's going to buzz. So you'll hear, hopefully somebody will hear it, but somebody's grabbed the AED out. Where the AED was at, there's a small med kit, and then around on in between where the officer sits and the defibrillator on the front, this bag is basically hanging like this. Okay, so it'll be hanging there. It does have a strap on it, so we can grab it, bring it to any medical emergency anywhere on the campus, whether it's student, employee, whatever we need. Okay? Now, the bag itself, who can use what or who can use it? We have to fall within medical training. So it's going to fall, although we're allied health and we have a lot of healthcare providers out here, we've got to make sure that we're still within your scope of practice on what you can and can't do by law. So if it's something as simple as a Band-Aid, hemorrhage control, you can grab some gauze out, put it on a bleed, and start wrapping that up. That's common. I call it mommy medicine because that's what mom would do, okay, or daddy medicine, however you want to look at it. So you can do things like that. Now you start looking at things like taking a blood pressure, the glucometer that I've added to it. You need to fall within a scope. So that's going to be more of the EMS personnel, nursing staff, respiratory staff, pharmacology staff. Y'all can't do blood sugars? Okay.
We don't do this.
But, right, okay, so who can do what, knowing what you can do. So, and then kind of gives you an overall, event that Donna called for somebody and it was the patient saying that, hey, my blood sugar, I have blood sugar problems. And she would know there's a glucometer in this bag. Who do I need to get that can come and check it? So that'll be a whole lot quicker to, hey, go grab Chastity or go grab Michael or go grab Star or somebody that they know that can actually check that before we get EMS and fire here. So always call 911, obviously. So what is in the med bag? This side pouch, and I'll let y'all look at this after we get done, but this side pouch, I have placed in a box of gloves. Now I did only put large, which I know is probably bigger than some of y'all's hands, but it is gloves that you can get in there, plus the guys should be able to wear them. Okay, but it's a big box of gloves, so we have plenty of gloves that we can use within the kit. Let's see, there are hemorrhage control supplies. They are in two different pouches within the bag. So we've got tape in this one, as well as some alcohol pads to replace. And then this whole outside kit on this side, there is roll gauze, cravats with the triangle bandages that we have to do like a sling and swath. There's packets of gauze in different sizes. All right, so we've got plenty of gauze we've got within the bag. And I have a ton of this stuff that we can restock it with without any problem. Like I said, I'll let y'all look through all this once we get done. Scissors as well. I've got them placed on the top. The kit came with a small bandage shear. I've added a larger set of scissors in here as well. So we've got those where you can cut the gauze. If somebody is bleeding from somewhere, their shirt or something like that, we need to cut around the area. we got scissors that we can do that with, and then we'll just clean those when we need to. This kit actually came with cervical collars, and we'll go over more of the use of them in a minute. But they're in the big center pouch, and they are in these packages like this. Alright, so I'll show you how to measure for those in just a second. There's a back valve mask, which I know everybody's had CPR. We did place a back valve mask in it, so that way we are able to ventilate if we have to do CPR, and we are not touching right at the mouth of the patient. Just basically, that's a big safety precaution. It's a big thing we did, as well as having oropharyngeal airways. Respiratory valve. There's a pulse oximeter that I've added to the bag. Alright, small pulse oximeter. We also have blood pressure cuff and stethoscope. They're located within the front pouch, as well as I have added a glucometer. Alright, functional glucometer. We've got several students on campus that have diabetic issues. I think the last time we come across an issue with it, I grabbed our other training ones, and either the batteries were dead or the strips didn't match the monitor. So we ordered several glucometers. So we have functioning glucometers in here. So while we're talking about this stuff, the collars themselves, can I go back to them for just a minute? These are called Philadelphia collars. And there are 3 different sizes in here. I'm not going to tear them open just for keeping them clean. But they're a 2-piece collar. You can probably see a little bit better when you look at the bag. What it has is Velcro on both sides of the neck. Okay? And the way we measure these collars is they've got a measurement guide on the side, and we actually measure the distance between the top of their shoulder to underneath their jaw. And it should match up on this collar. So if we place one of these, in my example, the guy falling down the stairs, if we think we need to put a C collar on, then we want to put the right size. We want them where they're just in a neutral position. You don't want the head tilted back or the head tilted forward. We want them just nice and straight. So you measure those there, and then we'll place them on. The glucometer is one of the other ones I really want to point out. The use of it with inside the kit, and I'll pass it around so everybody can look at it. The glucometer itself is on this side. There are strips, a whole bottle of strips in here. I place Band-Aids, so that way after we've pricked their finger, we can place a Band-Aid on so we don't have any blood being trailed around. There's alcohol wipes in this back part, so we are able to clean the skin prior to. And then these little orange devices are called lancets. They are very, very simple to use. And I know everybody that can do this are familiar with them. But you pull this little white cap off, and all you have to do, clean the finger, place it on, and apply pressure. It's spring-loaded. It will shoot the needle out into their finger, retract it back, so that way once it's retracted, you can't stick yourself with it again. The needle will not come back out. So these are safety lancets. So they're a lot easier to use. Okay? And then lastly, the back valve mask. I'll talk about it. And I'll go ahead and pass these around. I can look at it, kind of familiarize. Because if nothing else, I realize sometimes you may not be able to do that, but if we're checking the blood sugar, if you can grab out the Band-Aid and tear it open, grab out the alcohol wipe, you're helping, and it makes it a lot quicker to get it done. With the back valve mask, I am going to place a child-size mask in here for the face, so that way we have 2 different sizes. If we end up needing a pediatric, a very small, if somebody has their baby they brought by when they're registering or whatever, then you're going to have to holler for me or probably Judy to grab a smaller mask, even though this bag can be used for that as well. We can use this bag for any size patient. That's how much chest rise we get. Y'all remember that from CPR. So, summary of what we've got. We've got a medical bag. It's located outside the receptionist desk. It does have all these equipment in it, and we'll pass it around and look at it. So I hope this will help and make you feel a bit more comfortable with being able to respond to a medical emergency. Thank you.